as the participants join us for our event this evening. Good to see the participant numbers growing fast. This is our event on the effect of the coronavirus lockdown on the mental health of children and young people. Thank you very much indeed for joining us. The effect of the lockdown on mental health issues is a very important and lively topic for debate. A lot of research has been conducted into the mental health effects of the virus, and of course also the long-term legacy of the lockdown as we look cautiously and optimistically to it coming to an end. This webinar will look at what we know about the mental health effects of the lockdown and what expectations we should have for the post-lockdown legacy, and very importantly, what policy interventions might be best to tackle this. We've got three excellent speakers lined up who I will introduce in a moment. Do use the Q&A function if you have any questions. The Q&A function is more helpful than the chat function. It's great on the Q&A. Put in your questions. Don't wait to the end of the three panel presentations. And of course, you can upvote and support questions that other people have been putting in. So let's start with our first speaker. And I'm delighted that we have Professor Cathy Creswell, Professor of Developmental Clinical Psychology at the University of Oxford. She leads the Oxford Psychological Interventions for Children and Adolescents Research Group. Her research mostly focuses on the treatment of anxiety disorders, and she has been specifically researching some of the effects of the lockdown on mental health. So Cathy, thank you so much for joining us. Let's go straight over to you.
There we are. Hopefully you can see my screen okay. So thank you very much for inviting me today. Over the last year, we've been conducting a lot of research to try to understand the impacts that the pandemic's had on children and young people in the UK, and also to try and address some of those things that we've discovered along the way. Today, because we've just got a short amount of time, I'm going to just give you some of the main findings from our COAST-based study, which has been tracking mental health throughout the pandemic in children and young people. But before I start on that, I just want to highlight really that prior to the pandemic, it was already clear that we had a big problem in terms of the prevalence of mental health problems among children and young people. So in 2017, a nationally representative survey conducted in England found that 1 in 9 children and young people had a probable mental health disorder. And that reflected a significant increase from previous surveys, and most notably a 49% increase in emotional disorders compared to similar data collected in 2004. So we already had reasons to be concerned. And then clearly the pandemic has brought many other challenges for children, young people and families. So some of those that have come up and been identified in a range of studies are listed here, including concerns about the direct viral threat to young people themselves, their family, their friends, managing the ongoing uncertainty that they've faced, dealing with different pressures relating to schoolwork, learning from home, and so on, the economic impacts on families, managing boredom and not being able to do the usual enjoyable things, not seeing friends, feeling isolated, but also we've heard about increases in domestic violence and reduced access to support outside of the home. So we've clearly seen a number of particular pressures for young people. And what we certainly had a very good indication that this is likely to have had a substantial impact on the basis of a repeat of the national survey conducted by NHS Digital to look at the mental health of children and young people. And this survey was repeated in July 2020. And here, compared to the 1 in 9 children that had a probable mental health disorder in 2017, 1 in 6 children and young people were found to have a probable mental health disorder in July 2020. So there we were sort of a few months into the pandemic. And actually at that point, restrictions had eased somewhat. So as we'll see from our data, it's possible that that may be an underrepresentation of how things have been at other points in the pandemic. So I'm going to be talking to you particularly about the CoSpace study, which we launched a year ago now in March last year. And the CoSpace study is a longitudinal study where we invite parents and carers of children aged 4 to 16 years and also adolescents themselves to report on mental health symptoms on a monthly basis throughout the pandemic. And then we also try to identify how, who is experiencing what and what sort of factors may be explaining those differences. So one thing just to stress before going any further is it's really important to highlight that this is a sort of, it's an online survey, and we don't have a nationally representative sample. So particularly this is a relatively affluent sample compared to the general population. So it's really important that we don't use this data to draw conclusions about the prevalence of mental health problems. But what it can do is tell us how things have changed over time amongst this sample to get an indication of what might be going on more broadly, and also to look at how that's varied for participants in the study who are living in different circumstances or who have particular characteristics. And the main findings can be seen here, where we can see how mental health symptoms have changed over time throughout the pandemic. And you can see the yellow line shows you your primary school age children, and the blue line, the secondary school age. Now, this data is based on the parent report, because if we use parent report, we are able to look across that whole age range. And you can see that based on parent report, actually the line's a bit flatter for the secondary school age, but we see quite dramatic shifts, particularly in the sort of restlessness, inattentional type difficulties during the times of maximal restrictions. So we saw difficulties increase during the first lockdown, then start to reduce as lockdown restrictions eased, and then we've seen a recent increase again over the last couple of months. And generally that is a consistent pattern across the different sorts of difficulties that we've seen, and we've seen particularly in the secondary school age a recent increase in emotional difficulties. And of course, as symptoms increase amongst the general population, this means that the numbers of children and young people who are experiencing problematic levels of difficulties inevitably increases as we sort of shift the curve along towards the more problematic end of things. And so here you can see the plots to show the number of children and young people who were identified as possible or probable cases, so meaning they were likely to have a level of mental health difficulties that were severe and were causing significant interference in their day-to-day life. So this is important because, of course, people might say, well, of course, we're all going to experience different symptoms just because the environment's so different in the pandemic. But what this takes into account is actually people who felt that they were struggling, these difficulties were causing interference and having an impact in a negative way. And again, you can see a very similar pattern with some particularly striking levels of difficulties amongst the primary school age children, and again particularly when it comes to those more behavioural difficulties, conduct problems, hyperactivity, inattention. But also notable that there are amongst some groups we've seen notable increases at particular points among the secondary school age group. But really important to highlight that, of course, when you look overall across this whole population that's taking part in the study, it really loses the variation and the very different experiences that have been had by different people within the pandemic. And I think we're all very aware that we've all had very different experiences depending on our particular circumstances. So we've also looked at how changes over time have varied according to particular characteristics of the child or the families. And essentially what we found is that when we look across these different types of mental health symptoms, we find that there are a group of children and young people who had very low levels of difficulties at the beginning of the pandemic, and they've continued to be low throughout. So this is the line showed in red here. And actually, generally, this is about 50 to 60% of the children in each of the graphs I'm going to show you. And you'll also see there's a group here in green who were struggling at the beginning of the pandemic and have continued to throughout. But of additional concern is, of course, that you have this group in blue who started off in the pandemic with fairly low levels of symptoms, but those have increased as time went on. And here, this is looking at data from lockdown 1. And when we look at who these children are and how they differ from the red group, who have been fine throughout, we find a number of characteristics. So they're more likely to have been male when it comes to hyperactivity and attention, but also these children are more likely to be in families that are on particularly low incomes. Younger children are more likely to have had these particular difficulties, but also children and young people with special educational needs or neurodevelopmental disorders. And we also found some wider family characteristics that parents reported at the beginning of lockdown were associated with a more negative pattern. So that included parents reporting higher levels of depression, anxiety and stress, parents reporting higher parent-child conflict at the beginning of the pandemic, and also lower levels of family warmth at the beginning of the pandemic. And essentially, we see similar sorts of patterns when we look across the different types of mental health symptoms that we've been measuring. So again, for conduct problems, there's a substantial group in red along the bottom who've done very well all the way throughout, and a group at the top in green who were struggling at the beginning and have continued. And then there's some who've gone up and some who've gone down in between. And you'll notice the sorts of characteristics associated with those three groups who've had difficulties at some point in the pandemic are very similar to what we saw before. So including special educational needs, low income, high parent stress at the beginning of the pandemic, higher conflict at the beginning of the pandemic, and so on. And then finally, when it comes to emotional symptoms, we have a slightly more complicated pattern with a few different trajectories going on, but really the findings are quite consistent in many ways. In that, again, you have this significant group who've had low levels of difficulties throughout. And then the groups who have experienced more difficulties at some point during the pandemic, again, are characterized by these same sorts of things. So being on a lower income, higher parent-child conflict at the beginning of the pandemic, presence of special educational needs, higher parental psychological distress, and also in this case, the child having a chronic health condition. So just to summarise, I think we've seen very clearly that prior to the pandemic, the prevalence of mental health problems in children and young people was very high. And whilst clearly very variable, there is increasing evidence for a range of sources, and I've just spoken about a couple of them today, for an overall negative impact of the pandemic on children, young people and their parents' mental health. And we can talk more about that later if we have time. And really important to note that pre-existing vulnerabilities, so many factors that we already knew were associated with more negative mental health outcomes, have been associated with a more negative picture during the pandemic. So that includes poverty and other challenging family circumstances and children's special educational needs. So just to conclude, really, I think these findings highlight how critical it is that we make sure we identify those who do have enduring problems at this stage and going forwards, and make sure that we can identify those children and ensure that they can access evidence-based support promptly so that we can shift these negative trajectories. So thank you very much. I'll stop there.
Great, thank you very much, Kathy, and very interesting and good, and very useful to see those different trajectories identified. We're now going to go straight on to our second speaker, Lee Milligan, who is the CEO of MQ Mental Health Research, who's chair of the UK's Mental Health Funders Forum, advises the Old Party Parliamentary Group on a fit and healthy childhood. He's worked in the juvenile secure estate, alternative education and healthcare. Lee, thank you very much for joining us. Over to you.
Thank you very much, David. Hopefully you can all see a brighter future, both figuratively and on your screen now.
Yes.
So to build on what Kathy has shared with you, I want to try and take a look at sort of the three chapters of where we are today, looking at the pre-pandemic, current position and post-pandemic concepts. So the pre-pandemic era, if you like, in terms of children and young people's mental health. As Kathy said, the 2020 NHS digital survey, which happened just into the start of the pandemic, showed that there was a rise over 3 years from 1 in 9 to 1 in 6 school-aged children having a diagnosable mental illness. And suicide was recognized as the leading cause of death between 5 and 19-year-olds, which have been rising for the best part of 10 years now. Conversely, in terms of investment into mental health research, as we'll see, children and young people's mental health is not the focus of where research is today, and that's a huge challenge, considering 75% of all mental health problems develop before the age of 18. In terms of service delivery, we know that the mental health services are hugely stretched. Children's mental health services account for less than 1% of all of NHS spending, and the capacity of children and adolescent mental health services is under huge strain. 1 in 4 children referred to specialist mental health treatments are turned away, and 75% have such long waits that there's a detrimental impact on their mental health. That average wait time cruising above 12 months in recent years. We've also seen in the UK, and Jeremy Farrar pointed this out today in The Guardian, talking about the lack of continued investment in research. Mental health research has been flat for the best part of a decade here in the UK, and only or less than 4% of all of that spending is actually on prevention of mental illness. To put it in context, around £9 is spent per person with a mental health diagnosis, compared to over £300 per cancer patient being spent in research terms. So this huge inequality between physical and mental health was something we recognised way before the pandemic began. So what is the impact of the lockdown and the pandemic been? And it's fitting that we meet 12 months on from the start of the very first lockdown here in the UK. I think it's been said early on that we were all in the same storm, but I think we can all firmly agree that we've all been in very different boats. Children and young people, through a number of different research projects, have been highlighted as some of the most vulnerable groups in terms of impact towards mental health, as well as women, groups from low socioeconomic backgrounds, and particularly those that have recently just faced crisis financially. In terms of young people's education, we know that between 12 and 25% of children and young people lacked some sort of tools or elements of engagement they required to properly engage while schools were closed. And the NSPCC reported an all-time peak increase of 32% in distress calls to their helpline during the first national lockdown. So just as Cathy has pointed out, there have been some groups that started well and continue to do well, but those groups that started from a further back position have been continued to be detrimented. And this actually comes from the Emerging Minds partnership, some of the work that Cathy has been doing herself, actually. And I think one of the stark elements I've seen through the pandemic, both in terms of the research that's been done, but also, you know, when we look at some of the press conferences that have been held by government, is the lack of voice for young people. And these two comments in particular from the Emerging Minds work stood out to me. One on the left with a certain level of hopefulness that things have been tough, but we can move forward, but a recognition on the right there that without significant change in understanding of mental health and children and young people's mental health in government, then we're unlikely to see much change for the future. So chapter 3, post-pandemic world, an endemic world, whatever phrase you want to use, what do we need to make a brighter future? So at MQ, we've just launched our new research plan with 3 thematic areas that we believe need to be invested into. The first, entitled Thriving in a Post-Pandemic World, is the work we're carrying out right now, and I'll talk more in a second about understanding the impact and what we're doing about that. The second is one entitled Gone Too Soon, so looking at how we invest more money into research to reduce the mortality gap, both caused because of death by suicide, as we saw from the earlier slides, but also the interplay between physical and mental health. Those with a mental health diagnosis on the whole die 15 years earlier than their mentally healthy peers because of comorbidity between physical and mental health. And if you caught this morning the post-hospitalization COVID report that came out from the first 1,000 patients, we can see again the link between contracting COVID, physical illness, respiratory illness, as we thought it was, going into hospital, and 25% of those people 5 months on having a diagnosis of depression, and around 12% 5 months on being diagnosed with PTSD. The third area that we'll be launching is one referred to as Out of the Shadows, looking at radical treatments of depression, the thing that has been earmarked by 2030 to be the biggest global burden of disease worldwide. COVID hasn't overtaken that by any stretch. And we see increasing reports and results from research that depression is on the increase within children and young people as well. At the start of the year, we invested a further £750,000 into 3 new fellowships, one specifically a longitudinal study looking at the impact of COVID-19 pandemic as a stressor on young people's mental health, and 2 other studies into what we think are 2 of the biggest areas of children and young people's mental health today. We're also carrying out some policy and advocacy work. We'll be releasing a report next month entitled The COVID Generation as part of the all-party parliamentary group work with over 25 different researchers and authors who've submitted evidence to that publication. And that will bring together all of the thinking that we think is out there and present a way forward in terms of a policy recommendation. We're also working in partnership with the Royal Foundation and a wider group of researchers that Gregor, our next speaker, is also supporting at PHE, looking at the inequities in mental health research exacerbated by COVID-19. We recognise that particularly Black females are almost non-existent within research studies, and so there's more to be done to make sure that we get fully representative data to understand the true impact of something like the pandemic. So some of my thoughts on what the way forward looks like, perhaps. On the bottom right, we've heard the political aspiration to build back better. It's a wonderful alliterated 3-worded phrase, but if we're really going to make that a reality, then we've got to take a holistic approach and a whole child approach to understand that. I've a few thoughts from me. I think the future planning by government and civil society has to connect more clearly so that we have real-time understanding of what's happening. There's some fantastic work coming out of Scotland around the concepts like closed childcare clusters that look at how you can keep education open and well no matter what's going on. Ideas around hybrid and virtual learning for those with ADHD and autism, 2 groups that have responded very differently to the pandemic. I think there's a huge call we need to make on greater access to routinely collected data so that we can have a more live approach and understanding of how the policies we're making impact children and young people. And there's got to be a greater investment in mental health research. It's as simple as that. I'll pause my thoughts there, and with this final thought on investment in prevention and early intervention, I imagine I tee up Gregor Henderson fairly well for the next slot. Thank you very much, everybody.
Thank you very much indeed, Lee. Thanks for that. And it's good to see also the questions starting to come in as a good set to add to them, and of course upvote the questions that you are particularly interested in. We're now turning to our 3rd speaker, Gregor Henderson. Thank you very much for coming along, Gregor. He is the National Lead for Mental Health and Wellbeing for Public Health England. He's led PHE's mental health response to the pandemic. He's also one of the founding directors of the Wellbeing What Works Centre and chair of the research advisory group for The Place to Be, a national children's mental health charity. Gregor, thank you very much, and over to you.
David, thank you, and thank you very much to the Foundation for Science and Technology for inviting me. I am going to speak as an employee of Public Health England, but as it's after 6 o'clock, you may allow me to indulge in some personal reflections as well. And it's great following Kathy and Lee, because I have now had the ability to wipe off a third of my presentation, which was looking at some of the data. What I'd like to do, though, is make a plug for PHE and some of the stuff that we've been doing over the pandemic. If you want to get access to good, up-to-date surveillance of COVID-19 and its impact on mental health, and particularly there's a chapter every time we publish it on children and young people, then please do look at our COVID-19 surveillance report on the impact of the pandemic on mental health. We've been publishing roughly monthly since September. These are publicly available statistics, which we've amalgamated from a range of sources in as close to real time as we can. And also the next one will be out on the 8th of April, around about then. The second thing I'd like to direct you to is, or offer to you, is our psychological first aid training course for anybody working with children and young people. It's available on the Future Learn site. It's free. And at the moment we've had I think we launched it on February the 21st. And we've had nearly 60,000 people register for that course from across the world. So please do register for that evidence-based course. Very helpful and practical and quite simple in enabling people to respond to children and young people in the face of an emergency or a pandemic. What I'd like to do, though, is just offer a little bit more of a wider perspective. Because I come from public health, we are interested in the whole population across the life course. We are interested in the risk and protective factors that influence people's lives and the wider social determinants, particularly some of the inequalities and structural defaults that we find within our society: racism, sexism, misogyny. So we have to look at the whole thing in a big context. That makes it extremely complex, but I don't think we can look at the topic of mental health of children and young people unless we take into account that wider structural and cultural context. So let me just say a few things about before the pandemic. You've heard previous speakers talk about the shortages and gaps in children and young people's mental health services. There was also a dominant focus on service responses, and that dominant focus on service responses, whether they are through the NHS or through social care, wouldn't it be great if social care was funded more effectively, and also settings within schools, is the dominant focus on responding to the mental health of children and young people. The Children and Young People's Mental Health Green Paper, which is a joint green paper from our health and education departments, had a real focus on schools, and a lot of what I might say in terms of what comes after would be, again, not to put so much emphasis on some of the services and settings, because if we're looking at the mental health of children and young people, we need to be accentuating some of the things that keep us and our children and young people mentally healthy. Mental health and mental illness, there is a lack of focus on promotion and prevention and the social determinants, and looking at the risk and protect factors before the pandemic. Measurement was overly clinically based, focusing on deficits and symptomology, and research tended to be funded where it was funded for mental health in terms of clinical responses and illness treatment. And there was a pretty woeful attempt to engage children and young people, both in terms of policy development, but most importantly, in delivery. You've heard enough from the other speakers about what's been happening during the pandemic and the effects that's been having on it. But our recent chapter on children and young people's mental health states right at the beginning that available evidence suggests that children and young people have coped well. Life satisfaction appears to have only been slightly reduced, and children and young people's happiness appears to have been relatively stable. There is evidence suggesting that some children and young people, especially those with certain characteristics and social circumstances, appear to have experienced greater negative impacts. So we mustn't overestimate, but we mustn't underestimate, and we have to be proportionate in that. In relation to what comes afterwards, what I would be arguing for is a more targeted and proportionate response, where we're able to address some of the inequalities, race, and some of the other structural issues, where we look at mental health alongside our response to distress and illness, and we have a much wider cultural and social response to mental health, which is more than healthcare. And there are other countries which are way ahead of what we're doing in terms of turning our attention to some of the key things that matter for a society, whether it's New Zealand's attempt at looking at well-being indicators and well-being as a source of investment for how we might look after future generations, and judging our policy responses against an impact assessment on well-being. I'm thinking here also of the All Wales work in relation to the well-being of future generations. I think there are much more imaginative ways we can think about the mental health of children and young people in a wider policy context. We need much greater partnerships across, obviously, health and education, but local government, the engagement of communities, families, and parents, and the active engagement of children and young people. And when we talk about schools, it was really kind of a bit disappointing for me to hear our new children's commissioner talking about the need to have a counsellor in every school. I'm not so sure that that is the right kind of response to the social, emotional and psychological development of our children. And I'm lucky enough to do some pro bono work for the Place to Be. And they have developed a very sophisticated whole school approach where the culture and the ethos of the whole school attenuates the social, emotional and psychological development of the child, the engagement of the parents and the well-being of staff. I'd also like to see greater emphasis on digital and artificial intelligence. We need much greater resilience around the quality assurance and safeguarding, and looking at the evidence and the evaluation of digital and AI opportunities. But as we are talking here from science and technology, that offers us a wonderful opportunity for the future, as long as we're engaging children, young people and families in that. Measurement has to be wider, not just distress and deficit. We've got some amazing researchers in that field in this country. Pravita Patale from UCL. There's an amazing mental health quotient questionnaire that's been supplied by Sapien Labs, which has had over 48,000 people across the world do that. It's adult based, but I'd really encourage you to look at that. That's the kind of measures of mental health, mental distress, living with mental illness and recovering that I think we need. And there's another good organization to look out for, which is Impact Ed, which looks at measuring the impact of education. Research needs to be much more collaborative, more integrated, more multidisciplinary, much more intervention in early intervention and investment in promotion and prevention with children and young people at the heart. It's very encouraging to see the Wellcome Trust put multi-million-pound development into programs addressing the active ingredients of children and young people's depression and anxiety. And lastly, I think we should look for future innovation to come from our younger generations. People of my generation are, quite frankly, past it in understanding the contextual and personal, professional and social characteristics that young people face nowadays. I'm lucky enough to do some work for the Zinc Mental Health Academy, where I help curate some of the program. And we've got 30 pioneers who've been engaged in a 9-month-long journey looking at what they can contribute to mental health, and the activism, the advocacy, the encouragement and the positivity of young people in that group is quite astonishing. And they're moving to a venture build of 4, where 70 people from around the world will be spending a year concentrating on how they can use technology and digital technology in particular to improve the mental health and well-being of children and young people. So for me, it's about looking, yes, at the people who have been most vulnerable, but looking at how well and the ingredients by which people cope, they adapt, and the resilience that we build through adversity. So I would be accentuating the possibilities, not necessarily the positivities, and pushing the boundaries of science to go wider, and technology for good to improve the mental health and well-being of children and young people in the future. Thank you.
Great. Thank you very much indeed, Gregor. Can I invite all of our panelists now to turn on their videos again? Gregor did refer in particular to several research projects, and people have been asking about access to those. We will circulate links to both the data and the Future Lowen course that Gregor mentioned when we email people tomorrow about links to recording. So yes, you will get access to that information. We've got a lot of questions coming in after those 3 really interesting presentations. And I'm going to sort of link up several of them, because one line of questioning, going right back to Kathy's original point about her sample, she was explicit it wasn't being nationally representative, but it did help with trends. So one question arises from that is, how much do we know about the particular acute pressures facing low-income families? And I must say, wearing a different hat as president of Resolution Foundation, in work we've done on this, we've particularly focused on some of those financial and physical pressures, such as things like lack of space, lack of access to a garden. So I think it'd be interesting to hear from all 3 panelists about those type of pressures on people in low incomes, the extent to which those have been exacerbated during lockdown and explain the trends we've been discussing. But then let's link that up to an interesting exchange about social media. Another line of argument is that social media may have reinforced people's anxieties and mental health problems, though there are also people who don't think we should blame social media. So a bit more on the drivers, both in terms of financial pressures and wider social media pressures. Let's start with Kathy, and we'll hear from all three panelists. Kathy, over to you.
So starting with the point about financial pressures, I mean, certainly our data has been very clear that those who are living on very low incomes are reporting particularly high levels of difficulties. And actually, when we look at the CASENESS and those where it looks like children are experiencing levels of difficulty that are causing significant problems for the child and the family, the levels are really quite striking that we see amongst families who are living on low incomes. As we've said, we can only say so much from our particular sample. Unfortunately, we don't have a huge amount of other data to go on. There is some nice qualitative work that's been done. So both within our coast-based study, we've been doing qualitative work, but also others such as Helen Minnis in Glasgow, which also really highlight that, it's again a very variable picture. We can't draw firm conclusions. She's talked about from her qualitative work about some low-income families who were furloughed and actually appreciated the time that they had together as a family, whereas for others, obviously, that situation would have been much more difficult. So very difficult to draw very clear conclusions, but I think certainly our data gives us a lot of reasons for concern. And equally, I think, you mentioned, David, things like having a garden, and certainly from the UCL social study, which is with adults, one of the things that, the two main things that were associated with better well-being over time with the pandemic, as I understand, were getting outdoors and being active outdoors, and also gardening, which generally will rely on having a garden. So clearly, those sorts of things are big factors in terms of, the various pressures and opportunities that you will have during the pandemic. Shall I let others speak and come back to the question about digital?
No, don't worry. You keep on going, Kathy, and link that and move on to digital now. Yeah.
Yeah. So, I mean, I think the digital point and questions about social media are always there as soon as you start talking about young people. And obviously, people have lots of concerns about the impact of social media on young people's mental health. And I think I'm going to be really annoying because all of my questions are going to very much say it depends. Certainly, what we found within our study is that, as I mentioned, amongst our sample, we saw much more substantial impacts on younger children's mental health during the pandemic, and particularly at points of high restrictions. And we need to explore this more. But one thing that is really clear from our sample is that those secondary school aged young people in our sample were really well connected with their peers. So the vast majority of them were having regular contact with friends via, texting, phones, video calls, gaming, all sorts of different ways. That was not true for the primary school aged children, who only a very small number of them had any interaction with peers outside of the household. So I think in many ways, actually, the digital communication that young people have had has probably been a really positive thing for many. But of course, as always, it's going to be what you're doing online that is going to make the difference. And if you're having positive social interactions, then I think that would have been fantastic. And, when I think about, when I was a teenager, we wouldn't have had any of this. What would we have done in this situation? I've got no idea. So I think for many, that's been a really fantastic source. But of course, it's what people are doing when they're online that's critical.
Yeah, thank you. And thanks for bringing that very interesting contrast between the primary and secondary. Yeah, and I must say, some of our work at Resolution does also suggest that one of the reasons why younger people have been more vulnerable than older people has been that issue of access to space, access to garden, things like that, which are very, very generational and age dependent. Now, let's hear from Lee, your observations on what the drivers are.
Yeah, so going back to the first question around representation, I mean, the big challenge has been that a number of studies have tried to sort of look at the inequalities aspect of children and young people's mental health. And there's either been issues of them not being methodologically sound or not being focused enough. One of the better examples is through a project called the Adolescent Data Platform based out of Wales. And what that has attempted to do and successfully done is unite regularly collected data from across the GP services, judiciary services, juvenile services, education, and create a real-time database of information that works with that routinely collected data. And what that allows is a much broader representation, because you're not asking people to opt into a particular study, but actually have a platform in place. Now, Wales is in a unique position to be able to produce that, but MRC, the Medical Research Council, have just asked for tenders to look at how something like that can be replicated across the English constituent. So there is work to make that stronger, but access to routinely collected data is a challenge, and it's something that, depending on which department of government you are trying to access the data from, can be more or less of a challenge. Colleagues at DWP, for example, seem to be a little more reluctant to share some of the information that might be available compared to Public Health England. I also sit on the NHS Equalities Data Management Group, which essentially has been set up to look at inequalities in mental health and work out how the data set and the data structure needs to be changed. The architecture needs to be shifted to better capture that information. So there is work in progress to do this, but it is an enormous challenge. And as Gregor sort of alluded to as well, there is a systemic shift that needs to be made to really capture some of the correct information to then inform research. To the digital point, to sort of build on what Kathy was saying there, I would say some of the studies that I've looked at and that will be referenced in the paper we'll release with the APPG next month do look at this idea that the transition points of young people of secondary school age, as they sort of move from dependence upon the family to independence and interdependence within community, which is their friends essentially, that digital engagement has been a huge benefit for that group, but that the lack of play and interaction has been detrimental in terms of primary care. And there's been a big push, as some of you have seen in the press, from various groups to say, from a government policy of, catching up on learning, how about we catch up on social interactions for primary school children first? And that could be one of the best ways to move their education and health forward. So yeah, there's a few thoughts from me there.
Great, thanks very much. And Gregor, your observations on this?
Yeah, great. If you hear some whirring in the background, that's my dinner in the fan-assisted oven. This issue of drivers, this is really, really key. So we published around about October from PHE. We were asked by DHSC, the Department for Health and Social Care, to do an evidence scoping paper of what's the evidence of how you respond to and mitigate the likely consequences of a pandemic. And we did a scoping, not a systematic review, but a practical scoping of the evidence. And we published that in October. So that's another link that's readily available for people. And also in the surveillance reports, we look at some of those drivers. So government has been behind the scenes working, looking at these drivers of mental illness, poor mental health, and mental distress. And you will see that some of the responses to those drivers coming from different government departments, because you wouldn't expect, would you, all of the responses to children's mental health and how to mitigate it to come from the Department of Health and Social Care. So there's been a lot happening in the Department of Education, DWP. Now, some people say maybe not enough, but from the inside track, we have been impressed by the cross-government working. And hopefully there will be a cross-government mental health recovery plan published quite soon. But that work has taken into account the drivers. Now, obviously, we knew before the pandemic the drivers of poverty, the drivers of fiscal insecurity, the drivers of financial insecurity, and a lot of work has gone into that. But unless you grasp the real nettle of that, that's going to be a problem that will remain and continue to have significant emotional, social, psychological distress, which, if not dealt with, will lead to mental health problems. So do look at the PHE research, do wait and see the cross-government work, and do judge some of this on the cross-government response to what's been happening. And I think one of the things I would say, and this is me remember past 6 o'clock, so not necessarily talking on behalf of Public Health England, because I do have my own downtime, is that the Treasury promised 500 million for mental health in response to the pandemic. The vast majority of that is going to mental health care services. 79 million of that to children and young people's service responses. Now that's a great investment. No one would deny that investment. But in terms of the other areas that are the drivers, we would say that other areas have been significantly shortchanged to improve the mental health and well-being of children and young people. So when we say mental health, why do we always then invest in mental illness care and treatment and not invest more broadly across the piece? I'm being deliberately provocative, of course. Of course it's good to invest in mental health services, but that investment becomes unbalanced if that's the only place you put it. In relation to social media, it's all been said, but I've got 3 children, 2 are adults and 1 is 15, and social media has been good. And what we have found is that anxiety has increased among secondary school pupils the more they devour the media news outlets. So I think our media need to take a long, hard look at how they have represented life during lockdown.
Right, thanks, Greg. In fact, I'm going to stick with you because your comment earlier about the Children's Commissioner and a whole school approach has prompted several different questions on schools and the role of schools, which I'm going to bunch together and might ask you to comment on first. I mean, this just explains a bit more what you mean by the whole school approach in your critique of the Children's Commissioner's proposal. There's another question about to what extent homeschooling kids have we got any comparisons between those and kids who have, for whatever reason, been able to stay in school? The new mental health support teams in schools, what effect do we think they might have? So go for it, Greg. And I love your new 6 o'clock rule. I think I'll remember for all future representatives of organizations on our panels that after 6 o'clock, they can say exactly what they think. So go for it.
Well, what's the point, David, of being on a panel if you can't, get a little bit personal and a little bit dialectic? So I think whole school approach, let me just break it down for what's happening from the place to be's perspective, which I'm more familiar with. All the leaders in the school are trained in mental health. All the class teachers are trained in mental health. And that's not just being able to spot mental illness. That's about the social, emotional, and psychological development of a child. They also have access to significant supervision when they spot a child who might be having emotional or behavioral difficulties. And you can speak to any teacher. My oldest son, who's 30, is a primary school teacher in Islington, and he tells me exactly who the ones most at risk are. And it comes back to the social driving factors and the cultural and financial factors in their lives. So you've got the leaders, you've got the class teachers, you've got supervision, and you've got maybe 1 day of support with someone coming in. And what you have is a whole school ethos where everybody is trained to understand the social and emotional development. When you need support with a child's issues, which may express themselves as emotional, social, or psychological, the first point of reference is not to over-medicalize or pathologize that, but to understand the child and their context and use the experience of services when you need them. One of the worries about the multidisciplinary, the mental health teams in schools is it's a clinical outpost in an educational setting. And if that is reacted to in the wrong way, we are in danger of having a mass screening for normal psychological responses to everyday situations and life circumstances and medicalizing that and passing that to our mental illness treatment services to respond to. I don't think that's a progressive way for children and young people's mental health development.
Right, thanks very much. Kathy, anything you want to add by way of comments on that?
Yes, well, that was interesting actually to listen to, because we're actually doing a lot of work at the moment about screening for mental health problems in school settings, particularly in primary school. And so it was interesting to hear that view. And one of the main reasons that we're doing that work is that we found in previous studies that when we look at anxiety problems in children, they're extremely common. Anxiety problems have a particularly early age of onset. So half of all lifetime anxiety disorders will start by the age of 11. So we need to be identifying these things early, and we need to be intervening effectively. When we've gone out into the community and identified children with anxiety disorders, so that means they're experiencing a level of anxiety that is causing significant interference in their day-to-day life, we find 2% of the children we identified were accessing an evidence-based treatment. That seems shocking and needs to be addressed, I think, very clearly. And so we found from families that they experience a huge number of barriers in accessing support. There are problems around identification of problems. There are problems about recognising that support could be effective. There's problems about knowing where to go to get it. And then there's huge problems of actually getting it when they try. So basically, we're trying to bypass that. Oh, I've got a bit of an
There's
echo.
a bit of feedback suddenly. I
don't know where that came from. Seems to have gone.
Check everyone else is muted.
Yeah, and essentially, potentially by screening in schools, we could be overcoming lots of those barriers and making sure children who could benefit from support get it early. But I completely get the point that we have to be doing it properly. We have to be doing it responsibly. We can't just use symptom measures where we say, it's just about how you're feeling right now, because that does vary depending on different things. But we can do it in ways that really pick up, is this causing a significant interference in someone's life? And if it is, I definitely think that we want to be making sure people get evidence-based support. But I think with all of these things, it's really clear that it's not an either or. Of course, we need to be working at a universal level to support all children to thrive, but we also need to be very quick to identify where there are problems that are causing interference in people's lives and provide help quickly. And then we need to have the specialist services that we can call on when problems go beyond that and need further intervention. So I think, it's really important that we see all of those things as equally critical.
Thank you very much. Lee, anything you want to add?
I think speaking from my former role, where I was the executive principal of a multi-academy trust in Tower Hamlets, providing alternative education in a space where those that worked in the borough had an average salary of £100,000 a year, and those that lived in the borough had an average salary of less than £13,000 a year. I think this idea of a whole school approach that Place to Be and have been presenting is one that we were kind of on the journey of trying to get to at the time, maybe 4 or 5 years ago we were doing that. And we started out from that position of having a very siloed clinical approach to safeguarding mental health, special education needs, all of that, and having a devoted team just focused on that and trying to harness all of our knowledge in that one space, and moved over time very quickly to that whole school approach where we have everybody available and trained and understanding what we're doing so that we can work on tackling some of those factors in the round, recognizing that your background, your upbringing, and where you've come from have as much influence as anything from a medical perspective. So I would say there's a middle ground between what both Gregor and Kathy are trying to say, having seen it from the front line.
Thank you very much. I'm now going to try to squeeze in something about some optimistic observations, because of course, and Kathy, I'm going to start with you, because you did also have one of your trajectories was people whose mental health actually improved during the lockdown. And we've got one question about family units. I mean, some people might say some families function quite well, and it's even just possible that more time in a family setting might have helped people. So and we mustn't be unreserved. We must. So it's an opportunity just to try to disentangle anything good from which we can learn. Kathy, yes. Let's start with you.
Yeah, so I don't have a wholly positive answer. I'll start with the negative bit and then I'll end up more positive. I suppose the thing that makes this a not completely positive answer is those for whom we saw an improvement in mental health, it improved because it was quite bad at the beginning. And certainly from talking to families, this is during lockdown 1 particularly, we heard that from families, and this we particularly saw those reductions over time in families where children have pre-existing mental health problems. This is in lockdown 1, and I think actually for many people obviously things have changed as time's gone on, and also for children and young people with special educational needs. And in our sort of more qualitative work with families, we've certainly heard from some of those families that life became easier for some of those young people when they weren't in the school setting. They could learn in a different way at their own pace. There were social pressures that maybe they'd felt before that they didn't feel before. So it's positive in some ways that their mental health improved, but really it was the absence of stressors that led to that improvement. However, in terms of more general well-being, certainly in our qualitative interviews, we have heard from various families about things that they have appreciated about lockdown, and for many families they have talked about having that opportunity to spend more time together as a family, and which obviously creates stressors, but also in many cases some benefits and positive experiences too, as well as opportunities just to have a bit more time to do things that people might want to do, have a bit of break from the rapid pace of life that people are otherwise in. So I think it is really important that we do identify where people have experienced positives and benefits, and definitely try to hang on to some of those things and what we can learn from the environments children and young people are usually in, to try and make the most of that learning going forwards.
Thanks very much. We are now getting tight for time, so what I'm going to do is turn to Lee and Gregor, and then finally come back to Kathy. If you've got any observations on optimism, do chip in. But really, just in a minute, also looking ahead, what situation might we be in 3 to 5 years, and what are the most important levers, policy levers, to help try to get a better outcome? Let's start with you, Lee.
So, as the head of a mental health research charity that fundraises everything it spends, it'd be remiss of me not to say that we need more investment in mental health research. I think that is an absolute given. To have a situation where we're spending so little on research is a chronic problem that we've got in this country. I think that how we make sure that research is focused and directed correctly is part of that challenge. We spend a lot of time on what I would refer to as the characterization and counting of mental health, as opposed to looking at the prevention and the intervention processes that are required. And actually, we convened a large group of researchers 12 months ago, along with the Academy of Medical Sciences, and produced 5 consortia out of that group that went and proposed work that should be done around mental health and the COVID pandemic, and everything that was characterization and count got funded, and everything that was interventionist and preventionist did not get funded. So I think there is a fundamental lack of funding in this space. I could go on in a few other directions, but that seems to be the biggest single challenge that I would have to present.
Right, thank you. Very useful point noted. Gregor?
I've got 5, but I'm going to link them all together in a rallying call for a new way of doing things, David, which you at the Resolution Foundation, I know, will grasp with both hands. The first thing is family policy. Family relationships, absolutely crucial and key. And governments tend to shy away from family policy, and I think we need a much more positive view of family policy and the ways in which we are being asked to live, learn, and play, and the impact that puts in the family. I think for some people, the pandemic has opened up possibilities rather than closed them off. The second one is
very brisk. Yeah.
The second one is education, the purpose of education. What is the purpose of education? We ram our children into educational achievement. They've lost the power of play and collaboration. I think we need to revalue the purpose of education from the early years. Healthcare, move to prevention and the value of health over the value of healthcare, and fiscal, what's actually important to us in terms of what we purchase and buy, and a basic living wage. And I think if we look in 3 to 5 years' time, if we can spend 37 billion on testing and tracing for a health threat, could we not spend 37 billion on health and well-being opportunities and move to a national set of indicators that measure the future generation's well-being?
Thank you very much indeed for your rallying call. Kathy, we're leaving the final word with you.
Yeah, well, I absolutely agree with everything that Lee and Gregor have said then, and they've really covered most of the things that I would want to say. So I suppose the other thing just to highlight is, of course, as we come out of this, we need to see hugely increased investment in mental health and well-being in children and young people, from promotion to prevention to intervention. All of those things, you can't do any in isolation. And I think one of the, coming back to the optimistic point, the pandemic has provided an opportunity to really accelerate scientific learning and discovery. I mean, we've seen it at a huge scale. it would have been great to see even more of it in mental health, of course, but we have got some good new direction. So we've been able to do a couple of really large trials that are moving forward at the moment, using digital tools to get access to parents much more easily and flexibly to fit around their lives, but help them to manage things that they might be struggling with at a much earlier basis. So I really hope that the pandemic, if we can take anything from it, is really about shifting forwards how we do things, making the most of those kind of opportunities that we've had.
Yeah, well, thank you very much for that. And speaking now as a board member of UKRI, I'm very aware of some of those research issues and research challenges that have been identified. Thank you very much to our three panelists for excellent presentations, which have really helped us understand more clearly the mental health issues arising from the lockdown. We're very grateful to you all. There will be an email survey following this event. Do give us your feedback if you could. A recording will be on the Foundation's website tomorrow, and that will include references and links to the research that's been referred to during our discussion. Thank you all very much indeed. Particular thanks to our panelists. See you next time.